Hello, welcome to my channel. Today I'm going to be talking about the first month post-transplant and all the things that happened with it. So hopefully this is a pretty short video, but we'll see. So the first day of transplant, so I woke up after and was pretty groggy for the first day. I don't remember a whole lot. But I was able to post on Facebook even. I had my phone. So I did post hey, I'm okay, it's doing well, all of that. And then the next day went really well. They had me on a lot of pain meds and I was able to visit. I was still in and out, but I was able to have conversations with people. And then the third day, I was in the ICU because you need a one-on-one nurse after transplant, and the ICU gives, at least at Duke Hospital, that's what they did with me. And so I had a one-on-one nurse for the first 2 days. And then day 3, they sent me down to the transplant floor. So that was the first real transition I had after transplant, and that went not as well as it could have gone. And I think that was more psychological. The problems, there's so much difference, and I was really nervous about, the new kidney and how I was doing medically. So that was the beginning of a very long hospital stay. So day 3 is when I started kind of coming off of, I was on really, really intense pain medicine, and they took me off of one of them and gave me, just the smaller pain meds. And so I was kind of coming out of, that post-surgery stupor. And I started noticing a lot of pain, not a little bit at the incision site, and I didn't really notice the pressure so much as things like the IVs. So I had 2 IVs in one arm because it was a really hard stick, and both of those IVs hurt. Every time they pushed something through it, every time they flushed it, just moving the IVs were really rough. And I was like, can we please take them out? And they're like, absolutely not, you have to keep those in. So that was my number one complaint, I think, day 3 is because once I got out of those really intense pain meds, all this little pain started popping up that I wasn't used to. So the IVs were definitely a point of contention on day 3. Day 4, I had a belatacept infusion. So my therapy for my transplant is really, really, really minimal, which is really great. They gave me a huge dose of steroids during the surgery, and then I haven't been on them since. I'm on something called belatacept, which is an infusion, which is once a month now. It was, at that beginning, it was every couple of days, and then it was a couple, once a week, and now I'm down to once a month. And then the other immunosuppression that I'm on is called sirolimus or Rapamune, and that is, I haven't had any issues with that. But those are my 2 anti-rejection meds. The other things that I'm on are for blood pressure and an antiviral and antibacterial. I've got something for cholesterol, but my therapy, my medicine therapy is actually really small comparatively to what transplant meds usually are, which is a dose of 3. You have prednisone, you have Prograf, you have Cellcept, other things like that. So I'm not on any of that. I'm just on the belatacept infusion and the Rapamune. So on day 4, I was feeling pretty good. I was off the pain meds, and I was pretty emotional. I was very, all of it seemed pretty traumatic still. And then I had my belatacept infusion, and the psychological impact, I think, of getting that infusion done and realizing, how big it was and how my life was going to change. So after my infusion, I kind of descended into this very catatonic panic attack, and I didn't realize what was happening to me. So all of a sudden I got these very intense cold sweats, and I couldn't get my heart rate down, and I was freaking out. And then eventually I had stopped responding to anything. What do you want? I couldn't respond. So they had sent in, eventually, it took a little while, but they sent in a psychiatrist, and he was like, yep, this is anxiety. He kind of checked in on me, and he put me on some anxiety meds, which just knocked me out, just made me fall asleep. And so that was pretty rough. It was probably from 3 o'clock in the afternoon to 7 o'clock before I felt normal, and then I was only feeling normal for a couple of hours, and then they gave me another dose of the anxiety meds, and I fell asleep through the night. So day 4 was pretty rough. And then I woke up the next morning for day 5, my last day in the hospital, thank God. And I know it's a really short time to be in the hospital comparatively, but it felt like eternity. So day 5, I was still feeling pretty, like, I was having definitely anxiety, lots of panic feelings and stuff like that, but I was up, I was moving. And so they made sure that I was taking my pain meds, which is something that I decided not to do, which was not a very intelligent decision. Because, narcotics are such a stigma, and they're overused, and people misuse them a lot, especially where I grew up, in a border town on Canada. People misuse narcotics a lot, and it kind of left me with the feeling of, I'm really worried that I'm going to have some sort of reaction to this. I'm going to become addicted to it. I'm going to become dependent on it. And so I was really just, like, even in the hospital, I was just on the Tylenol for like a day and a half until day 5, and I couldn't come out of my panic, and then eventually I decided, let me take a half. And I took half, and then I started to feel a little better, as you would. And so I stayed on that pain medication through the life of that prescription. So that was 15 days or something like that. So on day 5, I was discharged, and then the next couple of days were okay. I was okay for a few days after that. I think it was probably like into week 2 that I started coughing a lot. I was having a lot of, because when they put you in surgery, you have the tube, and so your lungs don't inflate all the way, so you end up with, congestion and stuff like that. And I was coughing like crazy, and I had a runny nose. I was all congested and messed up. And so that was for a couple of days, and then in the middle of week 2, I actually started running a fever, which was super, I was already anxious from everything that had happened in the hospital. And then I was spiking a fever. And so I was checking my temperature like almost once an hour, because in the paperwork they say, if it gets over, if it gets to 101, you need to call us. It's an emergency. And so I kept checking it, and it never got above 99.9, so that's really good. But I was still feeling like super congested, like I couldn't breathe. It was making me anxious, it was making me uncomfortable. So I called my coordinator on Thursday after my surgery. So I got my surgery on a Monday, and so not that Thursday, but the following Thursday, I called them and I said, hey, is there anything I could take for my congestion? She goes, yeah, just make sure it matches up with what you're allowed to take in your paperwork. So I found, a decongestant medication, and I just started taking that. And then Thursday night, so this is, near the end of week 2, I started feeling that same panic attack situation happening. So I was getting cold sweats. I was trying to breathe through it because I knew it was just anxiety, but it was so intense. And I thought maybe at that point I didn't really know what had happened or what had started to cause it. But Friday was almost like in the hospital, where I was almost like, I wasn't catatonic, but I was crying all day, and I was having like a lot of anxiety, and I felt like a physical pressure on my head, and it would like come and go. But it was all the Friday was like that the Friday after, on the end of week 2. And so, the next 3 days I was in and out of that panic attack. So that was a 4-day long panic attack, essentially. And so I was trying to, figure out what it might be. And I was thinking maybe it's just how my body's reacting to the immunosuppression. Maybe it's a drug related thing. And I was like, well, if it's drug related, there's nothing I can do about it. How are you supposed to fight a drug interaction, especially mentally? So I ended up just going to my next appointment, which was on that next Wednesday. So from Friday at the end of the week 2 to Wednesday at the middle of week 3, I kind of was dealing with a lot of anxiety. And so we went in to see them, and they said, this isn't a drug interaction because none of the things that you're on have any neural effects. So this is you. And essentially it was like, this is how your brain is reacting. So I saw a psychologist, And we talked about medication, but we decided that that wasn't necessary at this point. And so I did a lot of research and seen that other people had also kind of had some of this, but it did seem like I was almost alone in the fact of having such an intense, 2 different panic attacks in the span of a couple of weeks. But after the fact, thinking about it now, I really just think your brain and your body are super connected, and I think a lot of the meds, my brain knew that things were different, and it just kind of, did what it thought it had to do to protect me from what it perceived as a dangerous situation. So that was week 2. After week 3, or at the end of week 3, I've been really good since then. Since I went in and seen them, and they said that it was, some sort of psychological thing. So I've seen a different psychologist. I've seen a couple here and there, just to check in with me, make sure I'm doing good. And I am. I feel way better than I had before. The infusion center still gives me a lot of anxiety, so I do take medication before I go in. It's a very, very low dose antihistamine, essentially just makes me a tiny bit groggy so that it doesn't seem so intense. But other than that, my anxiety level's been pretty normal. All of my labs, even through week 3, this is now 1 month, even up to every set of labs I've had from being in the hospital to now, my function is way, way, way better. My creatinine is super low. I'm stabilizing around 1.1, which is a great, it's just a smidge above normal, but it's really good. So all of my labs are normal. I'm feeling a lot better. I've been walking a lot. I'm recently trying to do about a mile a day at this point. They said, no jogging, no intense exercise for another couple of months. But I am cleared to do a lot of things in public, which, wasn't the case, even 10 years ago with transplants. So, but because, I am immunosuppressed, so I have to really be careful of people and public places, not to touch things that I don't need to, and to just watch other people's health, like if somebody's sneezing or coughing around me, just to be aware of that and to not go into that. So it does, before my transplant, I was working with kids, little kids, 3 to 6. And I'm a little curious as to what's going to happen, work-wise, because I am immunosuppressed. And so I will be talking to my doctors about how much of a risk working with kids is, especially very young kids, or if I would have to work with older kids or anything like that. But I already had so much progress from pre-transplant to now, where now I don't feel like any of those symptoms. So pre-transplant, the nausea, the muscle cramps, the fatigue, not being able to do anything after an 8-hour day at work, like not just being done. My mood, was all over the place. And so after transplant, I don't have any swelling. My weight has dropped a lot. I lost like 15 pounds post-transplant because of all of the water retention. So like my face was like round, and it has slimmed up a lot. So that's really good. That's my body taking care of, the water, and the new kidney is really doing its job. So that's important. Also, I want to mention that my donor has also been okay lately. She's one of my best friends. Well, now my absolute best friend, because she gave me a kidney. But she had a little bit of problems right after surgery, as anybody would have after surgery. But she's really bounced back, and she's working, almost a regular schedule now. And, there's just a couple of restrictions that she has, so she's doing really, really well. And so now, at the 1 month point, both me and my donor seem to be really healthy and doing good. So that is the 1 month post-transplant update. And thanks for watching.